So 2.1, physiology, the cardiac system, and blood pressure responses to exercise. So there's cardiac dynamics. The cardiac system plays a vital role in exercise as it pumps the supply of oxygen to muscles for them to function with enough energy. It also pumps deoxygenated blood to the lungs to get rid of waste products such as carbon dioxide. Cardiac output is known as the volume of blood pumped out the left ventricle per minute. This is made of two other factors: heart rate, which is how many times the heart goes through the cardiac cycle per minute, which is systole and diastole, and stroke volume, which is the volume of blood pumped out of the left ventricle per cardiac cycle, per heartbeat. This equation shown here. Heart rate multiplied by stroke volume gives cardiac output, as shown here. So some normal results for rest: in stroke volume 70, heart rate 70, cardiac output 5, and the other ones are shown there as well, for the different levels of intensity. So during exercise, stroke volume plateaus as intensity increases. This is because the heart starts beating so fast as heart rate increases that there is not enough time for the heart to become filled with blood. So there's not enough blood to be pumped out of the heart, out of the left ventricle per beat. So stroke volume plateaus, whereas heart rate just continues and is proportional to the intensity. When exercise begins, there becomes a higher demand for oxygen in the muscles. Chemoreceptors in the blood see less oxygen and a buildup of carbon dioxide. The receptors send an impulse to the cardiac control center, which sends an impulse down a sympathetic nerve here, which accelerates the speed of the sinoatrial node by releasing epinephrine. This speeds up the contractions of the heart, and therefore the heart rate increases as intensity of exercise increases. So yeah, this is a feedback response to meet the demand of oxygen. So we did two tests, like the same for the cardiac system. The multi-stage fitness test starts off at a low intensity and finishes at high intensity gradually. Here we can see that as the intensity of activity increased, so did the heart rate, very gradually. Before the test, there is a anticipatory rise in heartbeat, and this is our body preparing us for the activity we're about to do as adrenaline starts pumping. So in the test, heart rate increased from 96 beats per minute at level 2 to 141 beats per minute at level 8. So this is going from a low intensity to a high intensity. So we should expect to see an increase due to the intensity. The muscles are using more oxygen, so the heart beats faster to keep supplying the muscles with more oxygen as they're using it more through the high intensities. Cardiac output for the test can be estimated using normal values for stroke volume, which was shown in the table before. So level 2 is at lower intensity and sort of a sub-maximal exercise. The heart rate was recorded at 96 beats per minute. So using the average stroke volume for sub-maximal exercise, which is 90 milliliters, we can estimate that the cardiac output for level 2 is 8.64 liters per minute. This varies to level 8. Level 8 becomes maximal intensity and therefore maximal exercise. So the heart rate recorded for level 8 was 141 beats per minute. Using the average value for stroke volume at maximal intensity, which is 110 milliliters, we can estimate that cardiac output for level 8 to be 15.1 liters per minute. So we can see the difference in cardiac output due to the different levels of intensity, as explained before, but it's shown there's evidence for it in our test results. Another test we did was the Wingate test. This is a maximal intensity test, but for a short duration. Again, there is an anticipatory rise from heartbeat from 79 to 96 beats per minute due to adrenaline rush and body getting us ready. However, we can see that the heart rate increases rapidly from 80 beats per minute to 150 beats per minute at the end of the test here. The higher intensity work causes a much faster rate of increase for heart rate than the gradual multi-stage fitness test, which further shows a higher intensity of work will cause a much more rapid increase in heart rate due to higher demand for oxygen. Again, go back. Right. So again, we can estimate the cardiac output values for the different levels. So at rest for the Wingate test, the heartbeat was measured at 79 beats per minute. Using the average value for stroke volume at rest, which is 70 milliliters, we can estimate cardiac output to be 5.5 liters per minute at rest. I'll stop doing that. Post-test, the participant had been working at maximal intensity. So the heart rate value of 150 beats per minute can be combined with the average value for stroke volume at maximal intensity, which is 110 millimeters. So we can estimate cardiac output to be 16.5 liters per minute at maximal intensity. So the increase in heart rate increased the overall cardiac output value, which shows that, again, the higher intensities cause a increase in cardiac output due to the demand for oxygen and the want to get rid of the buildup of carbon dioxide. So, sports application. During a game of basketball, the levels of intensity will fluctuate, and therefore so will cardiac output. As we concluded before, that increasing intensity increases cardiac output, and therefore they are proportional to each other. When a basketball player is playing offense, as shown here, the cardiac output of the heart will be high as they are passing and relocating and driving past defenders, as in this picture, at a high speed and a high intensity. So the cardiac output increases to meet demand of oxygen, and pumping more blood to the muscles to keep them working. On the other hand, a basketball player shooting a free throw is a much lower demand for oxygen, as there is a much lower intensity exercise, so cardiac output is much lower during a free throw. Blood pressure is the force exerted by blood against the walls of the blood vessels. Blood pressure is affected by two factors, which is cardiac output, excuse me, which is how much blood is flowing through the vessels, and resistance, peripheral resistance, and this is shown in this equation here. There are three resistant factors. There's viscosity. This is the stickiness or thickness of the blood caused by plasma proteins. So increased viscosity of the blood will increase the resistance and therefore increase the blood pressure. Vessel length. So the longer the vessels, the higher the resistance, as there's a further distance for the blood to travel. So higher resistance, higher blood pressure. And there is vessel diameter. So if the diameter of the vessel is smaller, the pressure is a lot higher as there is a smaller area of blood to flow through. So increased resistance equals higher blood pressure. So blood pressure is made of two numbers. There is the systolic and the diastolic value. The systolic value is the blood pressure during contraction of the heart, and the diastolic value is the blood pressure during the relaxation stage of the cardiac cycle of the heart. So the systolic value we should always expect to be higher than diastolic, as there is a higher pressure when the heart contracts. And blood pressure is measured in millimeters of mercury. So in this picture we can see someone getting their blood pressure taken, and so the average value we expect to see, the normal value, is 120/80 millimeters of mercury, which is a normal value. So blood pressure changes as it moves into different vessels. Here we can see that blood pressure in the arteries and the aorta is relatively high. This is because the blood pressure has to be pumped. This is because the blood has to be pumped from the left ventricle to reach all the parts of the body. The pressure in the vessels slowly decreases, as shown in this graph, from the arterioles to the veins, where it reaches the right atrium. This is because the volume of blood increases, and so the pressure in the veins decreases, and they have a larger lumen to allow blood flow, so the restriction of blood flow decreases. During exercise and depending on the level of intensity, for example, blood pressure can still increase during isometric and isotonic exercise, as well as dynamic submaximal and maximal exercise. The systolic value can go between 160 and 220 for the systolic values, and the diastolic can change between 80 and 100 millimeters of mercury. So during the multi-stage fitness test, intensity increases. Here we can see that the systolic blood pressure increases as intensity increases. It increases by 45 millimeters of mercury. This is because cardiac output also increases during exercise, as mentioned before. So there is more blood flowing through the blood vessels, and therefore more force being exerted on the blood vessels, so a higher blood pressure during the contraction period of the systolic. The diastolic does also increase, but it's a little bit more, it's not as linear as the systolic. And during the Wingate test, maximal intensity is required throughout the whole test. Here we can see that the systolic blood pressure slowly increases throughout the test, but due to a short duration of the test, the increase is not as large compared to the multi-stage fitness test, only increasing by 15 millimeters of mercury. However, cardiac output still increases, so the blood pressure does too. Also in both tests we can see another anticipatory rise between rest and pre-test and rest and pre-test, also due to the heart pumping more due to adrenaline and our body preparing us for the exercise. So thank you for watching this video.